Hello, my name is Helen Hernandez, and today I'd like to talk to you about the R69 initiative. The problem we aim to address is this problem of how difficult and how time-consuming it is for a rare disease patient to go through the diagnostic odyssey. This is a diagram that shows an example of what a patient journey through diagnosis looks like in rare disease, and it's fraught with loops and frustrating turns of misdiagnosis or just not getting a diagnosis and bouncing from one specialist to the next. And ultimately, hopefully, a patient will receive their rare disease diagnosis, although some do not, and some take several years to finally get there. So this is a problem that really deeply impacts a person on this journey. And the scope of how many people are affected by something like this is really incredible. So several 100 million people on this planet have a rare disease and have to go through something like that journey. There are over 10,000 rare diseases, and so even really good doctors that are very familiar with the signs and symptoms of many diseases can't possibly be expected to understand what all of them look like. And what tests to run for all of them. So this is a really big problem that we have as a global community. And then I also wanted to point out the prevalence distribution of several thousand rare diseases actually looks like this, where the number of diseases is over here on the y-axis, and the prevalence per 100,000 is over on the x-axis. So even I point this out to say that even if one of the more common rare diseases have good awareness and it's very quick to get to diagnosis, and that this problem is being mitigated well in some cases, the vast majority of these rare diseases have extremely low prevalence. So the concern that I have is that even if individual rare diseases improve this situation, the vast majority are likely to be left behind unless we have a system change that helps facilitate the path to diagnosis for rare disease. So I was inspired to take on this mission when I learned about Zoya's law. So you all are in Serbia and so are likely very familiar with Zoya's law. And the part that really stuck out to me was that if a diagnosis has not been reached within 6 months, if someone remains undiagnosed for this duration, something happens. And in particular, Serbian doctors are required to send samples out for analysis. But I heard this and thought, why is this not something that's happening everywhere? This is so amazing. And so I started to think about what the challenges would be if this type of policy, if someone's undiagnosed for some period of time, something happens in a very simple way of thinking about it. If something like that were to be adapted for every country on this planet, what would be the challenges that we would all face in trying to enact something like that? And how can we work to address at least one of them? And so one of the challenges that stood out to me was that we have no systematic way of defining when someone is undiagnosed, when someone is somewhere on that loop, on one of the loops of their diagnostic odyssey. There's no way to right now know how many people are dealing with this situation. We need something like a flag in the electronic health record system or the various systems that exist around the globe to be able to say when someone is in this is undiagnosed. So this is not a totally new concept. Actually, the Global Commission to End a Diagnostic Odyssey for Children with a Rare Disease suggested that we do something like this using artificial intelligence to mine EHRs to flag patients who may have a rare disease in real time. And I think AI is really on the brink of being able to be leveraged for this purpose, and it's very exciting. And what I'm suggesting is something of that we start talking about a parallel path to this, to start flagging patients who may have a rare disease in real time, but doing something a little bit more manually in the meantime. And where I'd like to steer this conversation, that is a continuing conversation with medical professionals and patient advocates across the globe, is that we start thinking about the potential utility of R69, which is an ICD-10 code that means illness unspecified, for just such a purpose. If the communities can come together and understand how we want to use it, put together some kind of criteria with professionals that are in this field, and drive awareness of what that could look like, that would really set the stage for policy initiatives, much like Zoya's law in lots of different countries around the world. Another piece of our approach is to focus on resource sharing. So as we engage in lots of different conversations with people around the world about what this could look like, sharing things like the Undiagnosed Disease Network International, that exists. And it might be that some people just don't know that that's a resource they can turn to, or some people in Europe to the Orphanet codes might not know that there actually is a code for undiagnosed after full investigation. So something kind of on the other end of the diagnostic journey from what I'm envisioning we use the R69 code for already exists and is being utilized. And so spreading awareness, sharing resources of some of the other pieces of this overall landscape is I think important. And ultimately, whether it's through this manual approach or if artificial intelligence takes off and gets there first, that's great. The whole concept is that we should have a clean way to proactively identify patients that are on this diagnostic odyssey and start getting them to resources to help facilitate their diagnosis. So what we've done so far, we've had several roundtables and several individual conversations discussing the concept challenges that we anticipate, which looks very different in different countries, brainstorming solutions and reflecting on how to advance this mission without leaving many people behind. So that's an important piece of this mission. Current usage in the US is really interesting. So this is something that I would like to explore the data for many countries beyond the US. But right now, the data that we have on hand, thanks to Komodo Health, is that the R69 code is actually used to the tune of almost 4 million patients in a 3-year time span here. And they're used all across the US. And this actually, a lot of these darker states are higher population states. And so it's being used around the country, our country, but it's actually not being used at all in the way that I'm envisioning. And so it's being used mostly for things that are not related to specific health categories like pediatrics or emergency medicine. It's being used for things like medical nutrition, medical transportation, things that don't really fall into a specific category or kind of making use of this bucket term. But I think that we can very easily shift the way that this code should be used, and the fact that it's not being used how we see now means that actually, as we aim to advocate for its usage in a very specific way, to represent undiagnosed the way that the rare disease community knows that term to mean, I think we'll be able to very easily see in the data any impact of our efforts, which is exciting. And so I don't want to do this just in the US. I think it's very exciting to do it in the US, but also other countries around the world, high, medium, low income countries. And I intend on bucketing sponsorships in such a way so that we can really reach lots of people and help them get through the diagnostic odyssey more effectively. So with that, I'd like to thank you so much for your time and attention. I'd like to send a wonderful thank you to my team. I have an amazing group of people that are helping me get this off of the ground. And thank you so much to our inspiration, to our roundtable attendees, to our roundtable presenters, including Poyana, and to you for your time and attention. Thank you so much.